Hey guys! Welcome back to my channel. My name is Jewel, and in today's video, I'm gonna be talking about my experience so far in internal medicine posting in year 3 at Hospital Sungai Buloh. I'm actually studying in MAHSA University, and I'm gonna talk about my experiences so far as a year 3 medical student in internal medicine posting. So for year 3, in MAHSA University, those who are taking MBBS, we are actually posted to Hospital Sungai Buloh, and that is like about almost 40 minutes to 1 hour from our main campus in Bandar Sarjana Putra. I actually just completed my ONG posting, which is the obstetrics and gynecology. First of all, how long is it? So for every posting, we have 8 weeks. 8 weeks of classes or whatnot, then we rotate to another posting. But for internal medicine, and I guess the same applies to others as well, our theory only lasts for 6 weeks. And on the 7th week, we have our exams. So the first day is usually the OSPE and the multiple choice questions. And for that, we need to go to MAHSA University, or it depends which posting actually where they will have it. Usually it's back to campus. And from Tuesday until Friday, we will have our long case. So for long case, basically what they'll do is like they will assign you to a patient, and you have to clerk the patient. You have to take the history of the patient as well as come up with a diagnosis, and then you have to do the full examination on that patient. And then the lecturer will come and assess you, and then basically just explain your findings, and they will ask you a few questions on the spot. On the 8th week, we will usually have our logbook assessment, and we also have our portfolio assessment. Now for every posting, we are required to do two portfolio cases. So basically, we're gonna find a case, and then we follow the patient from beginning until they get discharged. So until they get discharged, or they, hopefully it doesn't come to that. But yeah, usually we don't follow the patient from beginning, because when we see the patient, they're already in the ward. Okay, so for the 6 weeks of theory classes, we have theory classes as well as bedside teachings. For those 6 weeks, we have different system each week. So we don't have the same system like every week, or we don't take everything all at once. So it's a bit systematic. First week, we started off with cardiovascular system. And for each system, we learn 4 diseases. So basically, we don't learn everything there is to know in the cardiovascular system, because in year 4 and year 5, we have internal medicine again. So we take it slowly. So for the first week, it's cardiovascular system. Second week is respiratory system. Third week is GIT and nephrology. Fourth week is endocrine system and hematology. Fifth week is the nervous system, neurology. For 6th week, it's infectious disease and rheumatology. So currently, as of now, while I'm filming this video, I'm about to start my 6th week, which is on infectious diseases. So we just basically need to clerk patients with malaria, dengue, HIV, AIDS, and so on. And also rheumatology. Where are the classes? For ONG, before this one, I was in ONG. Our classes are in Hospital Sungai Buloh, like in the ward itself. We have so for each ward, they will have empty seminar rooms, and usually in the morning, the leader of our posting group will come and book the room, and we will have our classes there. But for other posting, except PCM in 3rd year, we have it all in PKKN. And PKKN stands for Pusat Kawalan Kusta Negara. It's the leprosy center for the country. When it comes to bedside teachings, we have to go where the patients are. So usually from Monday to Thursday, we will have 1 seminar as well as 1 bedside teaching. And on Friday, we have maybe seminar. Sometimes it's IPS. I still don't know what this IPS stands for. And sometimes we may have formative assessment. Now, formative assessment is not counted actually for the end posting exam, but it's good for us as a practice. So sometimes they might give us OSPE questions, or they may give us multiple choice question, or MEQs. In PKKN, we are allowed to enter two wards, and in Hospital Sungai Buloh, we're allowed to enter 3 wards. So basically, it's level 4 and level 7, and 2 of the wards in PKKN. So when we have our bedside teachings, we are required to clerk a day before, meaning on Sunday, we have to go to the hospital and like find a patient that the particular lecturer wants for that week. So for example, that following week we have respiratory, we have to go and find a patient who has any respiratory related problems, and then clerk them, do the physical examination and present our findings. So that is until Wednesday, and then Thursday is our last bedside teaching. So on Friday, since it's just classes, most people won't clerk. Some of them might clerk just for fun like that and as a practice. For seminar, we don't actually learn like how we were in preclinical. Basically, the teacher will come in and give a lecture. No, it's not like that in clinical years. So basically, we will be given a topic or a disease, a title of a disease, and then 4 person will be assigned to a seminar, and among those four person, we will decide, okay, who's gonna do the etiology, and then you'll come to the pathophysiology, the diagnosis, signs, symptoms, differential diagnosis, management, and so on. So after that, we will have a class presentation. Every day we have a seminar. Every weekday we have a seminar, and then we will have a class presentation, and then after that, the lecturer will guide us where we probably missed out on some things or to add more information. Sometimes we also have case-based seminar, case-based discussion, whereby, for example, the disease that was assigned to us, for example, meningitis, we have to clerk a patient who has meningitis and then do the full clerking, whereby we have to do the history taking as well as the physical examination, and then present to the class, and followed by the normal requirement for a seminar, all the etiology and so on like that. Now for IPS, we also have IPS, so that is conducted by the lecturer, like they will come and teach us. So whatever is the IPS, like whatever are the RPS, all of those IPS topics, we will have it for our OSPE. So basically like chest x-ray, ECG, how to calculate if a patient has or had metabolic or respiratory acidosis, alkalosis, so on and so forth. Besides that, we also have on-calls. Well, we call it on-calls. They call it shadow housemanship. So that is from Monday to Sunday actually. Like our lecturer will say, you don't get leave on Saturday and Sundays when you are practicing medicine next time. So basically they will group us into like a group of 5, and then we will have to come or stay back. If it's a holiday, we have to come, and then if it's after class, we have to stay back, and it starts from 5 p.m. till 10 p.m. So basically we will go to the emergency department, and over there we ask the doctors or the housemen, like, can we follow you? And they'll be really busy, and basically they will just, whatever they do, we just follow. So not the whole group, probably like 1 or 2 students per doctor, and whatever procedures they do, we will note down, and we will see, ask questions. And it's kind of fun actually, because sometimes the doctor will ask you, do you want to assist? Do you want to do this? Do you know how to do this? Okay, you can do this. You can bring the patient in for chest x-ray, and then you follow them, and you feel good because you're doing something. How are the lecturers like? It's a mixture of both local and foreigners. And for the 3rd year over here, we have many cardiologists. Most of the lecturers are cardiologists, but we also have a pulmonologist, we have nephrologists, neurologists, and we also have adjunct lecturers. And adjunct lecturers are basically doctors or specialized doctors in the hospital who are tied to the university. So sometimes they will take us in for bedside teachings only. They will never come in for seminars, and so far all of them are pretty nice. Actually, there's this one teacher, he made an impression on us. So basically he's like, he calls us kids and he's rather strict, and he's kind of unpredictable, because one minute he can be really nice, and the next minute he's angry and everything. give to you guys who are currently studying in MAHSA universities, who's taking up internal medicine. So watch out when you come to his class. Please do not use your phone. He's very particular. Do not use your iPad, because I use iPad. I go paperless because it's really convenient for me to have all my books in one place and all my notes systematically arranged. I don't have to like go through the papers and bring files and everything. Do not sleep. Do not sleep. Even when you drink in his class, sometimes, you know, he will get distracted and he'll say, "You're distracting me." Do not simply move the chairs, especially when he's there. And if you accidentally move the chair, make sure you arrange it. And when you have him as your teacher or your lecturer for bedside teaching, please make sure you bring all your materials, all your medical apparatus, because he will not take the class or he will ask you to go back. So how do we study for this internal medicine? So since we enter, we're not allowed to like use our iPads and so on. I mean, we can use it for other lectures, but while we are there, it's best not to use it because we don't know when that lecturer may not like it. So we usually carry around this book. It's the clinical, I don't know if you can see, it's the Oxford Handbook of Clinical Medicine, and it's really cheap. If I'm not mistaken, I bought it for like only 30 ringgit, and it has almost all the systems. It actually has emergency medicine inside as well, and surgery. So it's a very good book to refer to, especially when you're gonna clerk a patient and you just want to go through the disease that the patient has and see what you missed out. So most of us will be carrying around this book. However, I won't say this is your only go-to book. Better to read the real book first, then you go through this. Okay, so the next part is just for those who is gonna take up internal medicine here under MAHSA University Year 3. So now when you come for the class, you have to make sure you print out the schedule. Always have a printed out schedule. So for mine, I made it into a booklet because it's really, I prefer it when it's in a booklet. It's just easier to, you know, refer through all the schedules, everything. So make sure you have your schedule with you always, printed out. Everyone should have. And then don't forget your logbook. Here's my picture. Okay, don't forget your logbook. So for the logbook, it's divided into 4 parts. So for the first part, you need to like clerk the patient, and what you clerk, you need to take their HLPI, physical examination, come to a diagnosis, differential diagnosis, and then what are the important investigations that should be conducted for the patient, and then maybe the treatment suggested for that patient, and then what advice would you give on discharge. And then the other part would be interpretation of investigation. Let's say maybe you saw an ECG or chest x-ray. So basically you write down what you see, like you need to write the patient's name and the hospital ID, and then interpret what you saw. Or maybe you saw a blood report or an LFT report, like that. Just write down what you see. And then for the other part, it is procedure. So if you watch any procedure, even as simple as catheterization or venipuncture, just write it down, list out the procedure, how it was done. And for the last part, it's in the emergency department, any procedures that you see. So yeah, the last 3 parts are actually done on call, but like for me, what I prefer to do every day, I will just do a little bit. I will find any ECGs or any other things that I can interpret and write it down, because I don't want to do it in the last week, then everything will get all hectic and messy, and then yeah, basically always have these 2 with you, your schedule as well as your logbook. And please don't procrastinate your logbook, just like write it after you're done with BST. And you can do extra as well, but make sure every BSTs that you have, write it down. Next is all your medical apparatus. So I actually keep all my medical stuffs here in this bag, and I carry it wherever I go, so it's easy. Everything is in one bag, plus the tendon hammer, but this can't fit here. We have another one, the small tendon hammer. I know you guys use it, right? There's like a smaller one with a metal handle, and then the tip is a triangle. Yeah, I used to have that, but our lecturer told us like it's better not to use that. Just come back to this, so just get this, guys. Okay, so inside you must always have with you, you need to get your neuro kit. So you can actually get this for like 9 ringgit in Kamal bookstore. It comes with the Snellen's chart, the cotton wool, and the orange stick, and also for smelling the coffee. Of course, your stethoscope, don't forget your stethoscope. Yeah, you need to have 2 plastic rulers because you need to measure the height of the JVP, but it's there's nothing wrong to have extras, and it has to be plastic, and it has to be 1 part transparent or both parts transparent. Yeah, just as long as it's plastic, not wooden and not metal, because the lecturer will be like, do you want to kill the patient? And you need to have 2 tuning fork. You need to get the 128 and 512 hertz. You must always have it with you. You can get it at Kamal bookstore as well. Pen torch, don't forget, and also a measuring tape, which you won't be using really. Yeah, you won't really be using, but you have to bring it, especially if you get certain lecturers who are very particular about the apparatus. So yeah, other than that, I'm gonna be done with my internal medicine soon. Honestly, it wasn't as fun as ONG for me. I felt like ONG was more fun. It's less hectic, but you need to remember a lot of physical examination, so every day just practice. After that you will get used to it. It'll be okay, it'll be nice. So guys, leave a comment down below if you are studying MAHSA and you have gone through internal medicine. What advice would you give for those out there who's gonna take up internal medicine, or who's gonna go through internal medicine posting soon? By the way, guys, how is this like? Do you prefer me doing videos like this, sit down and talk about med school or whatnot, or do you prefer me to vlog? I personally enjoy vlogging. Like, I feel less awkward, maybe because I've been doing less videos sitting down like this. I feel more formal this way. Yeah, do leave a comment down below. Which one do you prefer? Do you want more videos like this, or do you prefer vlogging, or what, or any videos you want me to make on whatever topic? Just leave a comment down below. And now I have 79 subscribers. Hopefully by then I can hit 100 subscribers, so do share it to your friends or family members who are currently studying medicine. It may be useful for them, especially those who are studying MAHSA University. Give me a shout out, do comment down below. I would like to know if you're currently studying medicine. Who knows, I may actually run into you. Who knows, we're actually friends. Okay, yeah, give this video a thumbs up, and I will see you next week.